Good afternoon. My name is Kristen Kilcollins, and I'm going to be presenting today on how important is health literacy and communication with our patients. Some of the key areas of concern that we will be focusing on today are communicating clearly, which is extremely important for obtaining exceptional clinical outcomes, as well as helping patients to manage and take their current medications. And how this helps us is that it allows for decreases in accidental overdoses, as well as helps for better compliance for prescription regimens. Communication for health literacy, what that means is that we are communicating health information clearly and our patients are understanding the information correctly. Good communication is linked to improved patient satisfaction, adherence to medical recommendations, and health outcomes. When healthcare professionals communicate poorly, our patients suffer. For medication management, the management and understanding of medications is crucial for positive clinical outcomes. Some of these key elements to managing meds are understanding prescription dosages, how much the patient should be taking, and how often they should be taking it. Knowing how long their medication should last, so how often they should be calling for a refill. So if a medication is supposed to last for them for 30 days, it should be lasting for 30 days. And they should be calling within a few days of it running out in order to get a refill. They should also know who they can talk to help with their medications. For example, calling a pharmacist, talking with their physician, mid-level provider, or even a nurse. Health literacy is the ability for an individual to understand the basics of healthcare information and services that are provided to them, so that they can make informed decisions about their medical care and treatment. On average, about 12% of Americans are proficient in health literacy. So if 12% of Americans are proficient in health literacy, that means that 88% are not. And that 88% is typically our clientele, our patients' family members. And if they don't understand their treatment or the medications that we are prescribing them, then we are really doing them a disservice. So today we are going to be learning how to do a teach-back technique for enhanced provider and patient communication. So the purpose of this exercise is to create a safe learning environment for our patients while improving communication by using the teach-back technique. So the teach-back technique is used to assess and confirm patient understanding. It also allows for the provider to measure comprehension and provides an opportunity for unique message tailoring. So what that means is if you're working with a patient and you've explained, say, they need to take so many units of insulin after they eat and after they've checked their blood sugar, if the patient can't verbally communicate that back to you, you have to work with them until they understand. And by doing so, it allows you to have a better patient-provider communication, which will ultimately provide a better result for the patient. So some key areas for improvement that we're going to be looking at today are medication management, which is critical for successful outcomes, as well as creating a communication loop between patient and provider, as well as learning how to effectively use the teach-back technique. So this will allow for tailoring communication techniques for each patient, as mentioned before with the patient who is diabetic and needs insulin after their meal, as well as better understanding of patient knowledge. When we talk to our patients, we need to actively listen and watch for unspoken cues. For example, sometimes our body language can give us away. And if a patient, you ask them if they understand and they get a little bit defensive, they might not, but they're not getting defensive because of the question. It's more that they're getting defensive because they don't know how to actively communicate that they don't understand. The tone of voice, usually you can hear a change in that as well. If someone's having a hard time understanding, then that can also, you can pick up on subtle little cues that the person is giving off. So today for our mini exercise, we've provided you with some materials. The first of which will be a handout that's describing the Teach Back technique. Next, you'll have prescription information with a drug that has all of the information as well as how to use it and what it's used for. You will also have pen and scrap paper, which you can use to take any notes or diagram out for your colleagues so that when you're explaining to them or trying to communicate effectively by teaching, that they will understand, even if it's by drawing a picture. Some people are very visual and they need to actually see a picture. All right, so the Teach Back technique, a brief overview. For example, you're going to start with a new concept. For example, you're putting a patient on a hypertensive drug such as lisinopril. You're explaining this new concept to the patient, and you are seeing how well the patient is recalling the information. If you explain and then ask open-ended questions such as, how would you use this medication? And the patient responds to you in a way that you don't feel that they've completely recalled or comprehended in the way that you want them to be able to understand, you clarify and tailor that information so that the patient can better understand. From there, you're going to reassess the situation. You're going to check the patient's recall as well as if they're comprehending. If they are, once you've gone all the way around, back to the beginning, say you've explained it to them and they can explain it back to you appropriately, you know that they're going to adhere to the protocol much better because they actually understand what is going on. So our communication exercise will be about 10 to 15 minutes long. It will be conducted with pairs, so you and one of your colleagues will be working together. And you're going to use the Teach Back technique to explain a prescription that has been provided for you, such as the lisinopril or even like metformin, some different type of drug, as well as explain what the drug is for. So you will be role-playing as patient and provider. So the first 5 or so minutes, one person will be the patient. And then after 5 to 7 minutes, you will change and the next person that was the patient will be the provider. So our goals are to assess the patient understanding by having them teach back. You want to create a sense of partnership with the patient. And you really want to avoid asking the patient if they understand. Asking them, do you understand, opens up a doorway for them to say yes, even if they don't understand what you're saying to them. And by doing that, we're really not allowing the patient to have a conversation, communicate effectively with us if we're just asking a question, do you understand? So our goal is try to avoid using that with our patients and asking more open-ended questions that will allow us to assess what or how the patient is feeling. After the 15 minutes are done, we will be reviewing, going over a few things, what worked well and what did not, as well as what were some of the challenges that were faced throughout the exercise, and then discuss some of the things that we can do better as we are working with our patients at the hospital or even in a clinical setting. So now that we have finished up with the exercise, I would like to thank you all for allowing me to teach you about health literacy and how important it is in the clinical setting so that we can have better outcomes with our patients. We have learned today the working definition of health literacy. We have also learned how to appropriately communicate with our patients, explaining medication management, as well as how to do the Teach Back technique and how important it is to get it right as we're going through it. I know that using these techniques can seem like they'll take a lot of time, and going through them will take time as we get used to it. However, keeping in mind that with only 12% of our patients understanding correctly what we're portraying to them is a huge problem. So taking the extra time to work with them and making sure that they understand what we're trying to communicate to them, as well as how important it is for them to understand, is a huge piece in compliance with all of our patients. So now that we are all situated and understand how to use the Teach Back technique, we can actively use it more as we're working with our patients. So once again, I would like to thank you for allowing me the time to go over this with you today, and I appreciate the time that everyone has put in, as well as giving me your full attention. Thank you once again. And have a good day, everyone.